Welcome. This is going to be part one of the passing of my 39-year-old husband and the relapse that I had due to this and how it affected me to lose him as I cold turkey one of the most powerful narcotics coming into this country right now. I'm going to try to make it in two parts. There's quite a bit of information, a lot of medical stuff that I should have become a nurse after. It's a very harrowing story. I'm going to keep it together. I've made several of them, but I feel as though I've come to the point in my grief where I can talk about it informatively and maybe help someone to be checked for this, to be aware of this, and to understand what Justin went through. So, it's nice to meet you. I'm Jamie. My husband and I live a quiet, small life in Tennessee. We don't have a lot of money. He was an electrician. I got to stay at home and do astrology readings and do makeup lives. It was more of a hobby than it was a job. We had a company van. I'd struggled with, addiction in the past and was in recovery. I had a DUI a while back. I did not have my own vehicle. We paid all the fees but hadn't gotten the interlock. He was driving a company van. Did a Christmas, and it was a snowy winter of 2023, and we had more snow than we usually ever did on that particular winter because nobody likes talking about the weather that much, but just for reference, in the 15 years I've been there had been at least eight winters where we didn't get any weather at all. And if we did, it was a snow dusting. And this was coming down like a dang blizzard on the day he needed the ambulance and the helicopter the most, because when he got to the hospital, he could not feel his legs, he said, and he had a stabbing pain in his back. These two symptoms combined, he had been saying for several months that he thought something might happen to him and that I would have to be prepared. And I would say to him, don't you dare say that. Don't you dare. That is everybody's worst. Hear that from your husband? That's terrifying. I said, no. We're going to pray. That's not going to happen to us. Don't worry. I said, we have a long, happy life to live together. We were very much in love. So he had these awful feelings, and the ambulance came and got him. They brought him to the local small hospital. The local small hospital, he was joking with them and everything. He had his finger on the oxygen, and that was it. And then they called me in the other room, and I was a CNA, so I knew what, I'd heard of what he said, but I wasn't aware of what it was. And I had not heard many patients that had this. It was just in class I learned of it. An aortic dissection, type A. The most, he had like a 4% chance of living. Most people die from it. They don't get to the hospital in time. Your aorta burst, or you had 4 layers to it. 3 of his had burst, and there was 1 layer hanging on, and all of the blood in his body was bubbling into that layer. It was bubbling out. It wasn't going to his heart or his vital organs. That's why he couldn't use his legs. And everything happens fast, okay? He gets to Vanderbilt. I don't get to see him for like 10 hours. I have photos of me in the waiting room. I had documented this all in a very frenzied, non-medicated bipolar way. So it was awful to try to decipher. I might maybe edit those videos and find the footage that I could use. Might include that in the next video. I'm going to try to give you as much information about this because this story is beyond, okay? I've not heard anybody else that has a story like this. When he went into the, Vanderbilt, and he went to surgery, I did not expect what I saw when he got out. They took him to the ICU, cardiac ICU. He was the #1 patient in the whole entire hospital at the moment that was like on the verge of that they thought was going to probably I was told, expect him to. Hope for the best, expect the worst. He just barely with an 8% chance to survive the surgery. However, all of his organs began to fail because of the lack of blood circulation. He was on kidney dialysis, ECMO. ECMO is a life support that goes through your whole body that filtrates your blood for you because you can't. So he had ECMO, which is a very expensive, very complicated life support. He was not on a ventilator, but he was on a tube that went through his neck that was incredibly uncomfortable because his mother had it. And both of us agreed we would never do that to each other with the tube in your throat. He couldn't talk, he couldn't anything communicate, even when he came out. And he hated that. He wanted to at least be able to communicate with me. And they had to go in a second time for his second surgery because his legs were not working still. And they were going to do what was called a fasciotomy, where they, trigger warning, and I'm not going to include the pictures, but they look like he had a shark bite. They take a fascia instrument in through the layers of your skin to find out where the living tissue is, okay? And because it hasn't gotten any blood flow, it's not going to survive. So they have to go down into that layer and then cut all your skin, and then in an incision down to that layer. I might be not getting it 100% right, and if there's a nurse that wants to chime in, I respect and appreciate all medical advice and helping me to better convey this in the next video. I saw his leg, and I saw him. I mean, like, he had tubes and wires everywhere, 4 or 5 in his mouth and nose. Things on his head, stickers everywhere, IVs galore, like 6 or 7 different ports. They were putting IVs, the ECMO going through him, the dialysis, kidney dialysis, permanent. They said, till further notice, on kidney dialysis, his kidneys were failing. His doctor looked at me and said, he's a very sick man. He might not live through the night, okay? And I'm a hysterical person, and I'm maturing now that I am getting older. I'm realizing being a hysterical girl in all situations is not going to get you anywhere other than ask to please leave. I had to pick up myself by my bootstraps, but I felt like I was living in Twilight Zone. I was like almost catatonically in shock that I was very possibly, when I brought a change of clothes to the hospital with me, because I thought the worst case, my husband would have a heart attack like his brother, which would be horrible, but they would put a stent in and he would have to get regular medical checks for the rest of his life, but he would go home. I was very, very sorely mistaken for 3 months. My husband was in Nashville for 3 months, and I had no vehicle, and these places didn't always have a shower. I literally was a nomad living, taking a bus and spending 4 days in a hospital room and showering when I got home. I'd bring luggages, big luggages, because when I was in the room, I'd been a CNA. I could care for him. I could tend to this or that for him, grab him this, grab him that. I was spoiling him. I mean, the man was in a great deal of pain, I might say also. And at some point, they were giving him shots of Dilaudid because he was getting the wound care and the shark bite incision. I don't know if I get that flagged. I have the picture of it. I have never in my life seen anything like it, and he never regained the muscle or the use of his legs. This is just a spoiler alert on that one. But all of that pain and gruesomeness, and they weren't able to fix it. But they weren't giving him his medications. Some of them that he normally took, like his clonazepam, his gabapentin, and some of them they weren't. And I was afraid he'd go through some form of withdrawal. And of course, this is where the addiction problems come in. And this adds a whole new layer to this onion of an issue and a problem. And I'm going to get to that for you in part 2. And I hope you stick around because Justin deserves to have his story told. This man, I'll get into a little bit more about his character when we come back, and you can understand how I handled it and how I lost my sobriety for a while. Hope to see you soon.